My name's Tina.
Hi, Tina.
I'm going to be doing a motor exam on you today. Can you tell me what your name is?
Michael Newberry,
Tell me what year it is.
2015,
What month are we in?
September.
And what day is it? Do you remember what day?
I'm going to say the 27th or 28th.
27th. Okay. I'm going to have you count forward by 4, beginning at 4.
4, 8, 12, 16, 20, 24, 28, 32.
Okay, excellent. All right, so now I'm going to inspect the skin for any kind of lesions, scars, abnormalities. I'm also going to look for uniformity and color. We're going to check temperature. Then we're going to do texture. Check skin turgor. And then we're going to do capillary refill. And also just make a general note about the condition of the nails, fingernails, and toenails. Then we're going to look at the hair. Hair is evenly distributed, soft and brown. No evidence of male pattern baldness. All right, where do I go from here? We're going to palpate the scalp. And then we're going to do lymph nodes. So we've got 9 areas. Occipital, post-auricular, pre-auricular, tonsillar, submandibular, submental, the posterior chain, the anterior chain, and then the supraclavicular. All right. Then we're going to palpate the sinuses. Any pain or tenderness in the sinuses? Any pain or tenderness? Okay. We're going to do temporomandibular joints, so open and close your jaw. Okay. We're going to do the masseter muscle, so clench your teeth. Okay. All right. And then we're going to do ears, so we're going to inspect the ears behind. And this one. We're going to do some hearing tests. So I'm going to cover your left ear and whisper something in your right ear, and you need to tell me what you hear.
20.
Okay, we'll do the right ear.
40.
Okay, now we're going to do the Weber test with the tuning fork. Tell me if it's equally heard in both ears.
Yes.
Okay. Now we're going to do the Rhine test. So I'm going to put this behind your ear, and when you hear it stop ringing, tell me, and then I'm going to move it in front of your ear. And then you'll probably hear it ringing still, and then once that stops, you need to tell me when it stops there. Okay?
Mm-hmm.
Stopped?
No.
Okay. You should still hear it.
Go.
Okay, now we're going to do the other side. I'm not very good at doing this.
Mm-hmm. Mm-hmm.
We're going to just inspect your eyes, look at the eyebrows, the eyes, the irises, the pupils, check out your conjunctiva, lower and upper. I'm going to palpate the orbital area, any pain or tenderness.
Mm-mm.
Okay, we're going to do a bunch of eye tests. hold this about 14 inches from you and read the lowest line that you can read.
Do I need to cover an eye?
Oh yeah, sorry. Cover the left eye.
The left
Or
eye?
whichever eye. Cover one or the other.
I see 4, 2, 8, 7, 3, 9.
Okay, now do the other eye.
4, 2, 8, 7, 3, 9.
Okay. 4, 2, 8, 7, 3, 9. That's 20/20. Now we're going to do peripheral vision or the confrontation test. So basically I'm going to put my hand out of the field of vision and draw it into the field of vision. You need to tell me when you see it. So cover your right eye, okay? And you just tell me when you see it.
No.
Okay.
No. No. No.
Okay, now we're going to do the other eye.
No. 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 No.
Okay. Now we're going to check your corneal light reflex. So just look straight ahead. Okay. Now we're going to check cover uncover test. So cover one eye. All right. Focus on this. Now uncover your other eye. Okay. Now we're going to do the left eye. Same thing. Focus on this. And then uncover your eye. All right. Now we're going to check the 6 cardinal fields of vision. So just follow the pen light. All right. Now we're going to look for lid lag. So I'm just going to draw it up and down. All right. Now I'm going to shine this light in your eyes, and we're going to check your pupillary response. All right. So, okay. Now I'm going to check consensual response in the left eye. Okay. Check. All right, now I need you to focus on the wall, and then I'm going to put this in front of you, so check accommodation. Focus on this. Okay. All right. Now I'm going to inspect your nose. Any pain?
No.
The nose is symmetric. There's no ridges. Color is uniform with the rest of the face. I'm going to look in the nares. Inspect the turbinates. Okay. Now we're going to do the mouth. So open your mouth for me, please. All right. We're going to look at the teeth and look at the buccal mucosa. Can you stick your tongue out and say ah? Okay. Now lift your tongue so I can look under it. All right. Stick your tongue out and go from, and stick it to the, like bend it to the left and to the right. Okay, and now do the right side. All right. I'm going to look at the sides of your tongue to make sure that you don't have any lesions. Okay, so stick out your tongue for me. I'm going to grasp it with this. All right. Sorry. No lesions. No lesions. All right. Let's take a look with this. Open again. Okay. Now I'm going to look at the neck, inspect the neck for any neck vein distension or any abnormalities, and look at the trachea. Trachea appears to be midline. Now we're going to palpate the trachea. We're going to palpate the thyroid, so turn your head to the left a little bit. Oh, why do you go to the water? Okay, hold this. All right. So turn your head a little bit to the left, or right, sorry, you're right. All right, I'm gonna push. All right, I need you to take a swallow. Oops, sorry. Okay, now put the water in your mouth again. Don't swallow it. Look that way. Not too much. Okay. Swallow. And we're also going to assess the trachea for a tracheal tug. Now we're going to go and do the chest, so I'm going to look at your posterior and lateral chest. First, I'm going to inspect the skin, no lesions. Breathing is easy, there's no evidence of retractions or accessory muscle use. We're going to palpate. Let me know if you feel any pain.
No pain.
Okay. I'm going to do tactile fremitus, so say the words 99.
99.
Again.
99.
Again.
99.
Again.
99.
One more time.
99.
Okay. I'm going to percuss. Okay, and now we're going to auscultate the lungs from the posterior and the lateral. Breathe deep for me. Okay. And while I'm on the back, I'm going to check for costovertebral tenderness. Any tenderness? Any tenderness?
No.
Okay. Now we're going to do the anterior lungs. Inspect again. No lesions, no abnormalities. Breathing easily, no retractions, no accessory muscle use. We'll palpate. Any pain?
No pain.
All right, and we'll auscultate. Breathe. All right, now we're going to move on to cardiac, so I need you to lie back.
This way?
Yep, please. Thank you. I'm going to inspect the precordium for evidence of heaves, lifts, or thrills. I'm going to look and see if I can see the apical pulse, if it's visible. Now I'm going to palpate and auscultate in the 5 areas of the heart, which are the aortic area, which is at the 2nd intercostal space on the right sternal border, the pulmonic space, which is 2nd intercostal space, left sternal border, the 2nd pulmonic area or Erb's point, which is at the 3rd intercostal space, left sternal border, the tricuspid area, which is at the 4th intercostal space, left sternal border, and the mitral area, which is the 5th intercostal space, mid-clavicular line. So I'm going to palpate for any kind of thrills, heaves, or lifts. All right, and now I'm going to auscultate with the diaphragm. And then the bell. Something I forgot to mention during the part of the lung assessment was that if I had heard anything abnormal during the lung assessment, I would have gone on to do egophony, bronchophony, and whispered pectoriloquy. So now back to the cardiac. If I had heard anything abnormal with the cardiac assessment, I would sit the patient upright or turn them onto the left side to bring the heart closer to the chest wall. Also, I need to mention that S1 is the closing of the mitral and tricuspid valves, and S2 is the closure of the aortic and pulmonic valves. A systolic murmur would be heard after S1, and a diastolic murmur would be heard after S2. Now I'm going to go and I'm going to palpate and auscultate some of the arteries. So first I'm going to palpate the temporal arteries, and then we're going to auscultate the temporal arteries. Okay, then we're going to palpate the carotids and auscultate them as well. Okay, now we're going to palpate the other carotid and auscultate. And you're looking for thrills or bruits. Now I'm going to just palpate some other arteries. So we're going to do the brachials. Okay, we're going to do the radials. We're going to do the popliteals. Okay, we're going to do the posterior tibialis. And the dorsalis pedis. Next we'll go on to the abdomen. We'll inspect the abdomen for any kind of waves of peristalsis or stria, abnormalities, masses, anything visible. Then we auscultate the 4 areas. Then we percuss. And next we're going to palpate lightly. Any pain with palpation?
No.
All right, and then we're going to do deeper palpation.
A little bit there, yeah.
Okay.
A little bit of pain in these areas.
Okay. Then we're going to feel for the aortic pulse and check the aortic width with deep palpation. Okay. Something I forgot to do was check the sensation in the face with cotton ball, which I'm going to do with him laying down. It's a little unorthodox, but this is how I'm going to do it. All right, so I'm going to touch you with this and let you know what it feels like. This is testing one of your facial nerves. So now I need you to close your eyes. Tell me when you feel it.
Mm-hmm. 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 Mm-hmm.
Okay. All right, so I've completed the abdomen. Now we are going to go to musculoskeletal. We're going to do the hips. So let's do hip abduction and adduction. So take your right leg and swing it outward. Okay, and now crisscross it over your left. That's abduction and adduction. All right, put that one down. Now do the same with your left. Out, in. Okay, we're going to test internal and external rotation. So lift your right leg, put your foot on your left knee, and rotate out your leg. That is external rotation. Okay, now we'll do internal rotation. So put your foot on the bed, and then turn your, there you go. All right, so now we're gonna do the same thing with the other leg. So take your left foot to your right knee, put your left knee out, that's external rotation, okay? Come back up, put the foot on the bed, and then pull it in here, okay, that's internal rotation, all right? And then put your leg straight. Now we're gonna test flexion, so right knee to chest, okay? Now let's do left knee to chest. All right, and we will do hyperextension of the hips when I have him standing later. Now we need to do hip strength, so pull up against my, all right, and then strength on the left, same thing. Okay, now I'm gonna have you sit up. You can sit aside. All right, now we're gonna do the other musculoskeletal system, so I'm gonna check his joints for any kind of inflammation, masses, any other kind of abnormalities. We're okay. We're going to do the neck, so flex forward, no, not like that. Chin, tuck the chin, so that's flexion. Now backwards extension. All right, now I need you to laterally rotate, all right, that way, okay. And now chin or ear to shoulder. All right, and now we're gonna do strength. So push against my hand. Okay, and now pull against my hand. Okay, and something I forgot to do in the nerves, we're going to do one of the other facial nerves. So we're gonna do lateral turning. We just showed lateral turning, so do it again. This way and that way. All right, that way. Now we're gonna do it against my hand. So this tests one of the cranial nerves. Okay, now shrug your shoulders and down, and now against resistance. So that's a cranial nerve. That's a little bit out of sequence, but at least I remembered. Okay, we did the neck. We're gonna do elbows. So flex the elbows up, okay, and extend them down. Okay, now we're gonna do pronation and supination. So supination, pronate. This is internal and external rotation, so back up. Okay, now we're going to flex them again because we're going to check your strength. Now push against my hands, and now pull against them. Okay, so that's elbows. Now we're going to do wrists, so flex your wrists, hyperextend them. Okay, and now flex against me. All right, push against me. Okay, so that's the wrists. Now we're going to do fingers, so flex your fingers inward, extend your fingers, and then we're going to check grip strength, so squeeze. All right. We're going to do knees next, so we're going to flex, well, extend your knees. It's going to come out, do one at a time, okay. Do this one, okay, and that's flexion. Now do it against gravity. Okay. All right, and that's your strength. Now we're going to do feet. So plantar flex, which is towards this floor, and then dorsiflex up. All right, now we're going to do the same. So put your feet back in a neutral position. Now plantar flex against to check your strength, and dorsiflex. Now I need you to invert your feet. So they're going to come in, okay, and now evert. All right. That's all the musculoskeletal. We're going to check joint vibration. Okay, I'm going to activate this and put it on a couple of your joints. Just let me know if you feel it.
Oh yeah.
Okay.
Mm-hmm.
Okay. Not very good at this. All right. Feel it? Or am I not on the joint?
Yeah, I can feel it.
Okay.
So it's minor, but I can feel it. Mm-hmm. Very minor. Mm-hmm. Mm-hmm.
Okay. Joint vibration. Now we are going to do deep tendon reflexes. Okay, we're going to do the brachioradialis. No, this is not brachioradialis. Brachial first. All right, so just put your arm like this. All right, ready? I'm going to strike my thumb and try to elicit a response. And, okay, we got that one. We're going to do the other arm. Same thing. Okay, we elicited a response. We're going to do the elbow. So just relax your arm. Okay. Okay, we got that one. Same thing over here, relax. Got that one. All right, now we're going to do the brachioradialis. So just relax. Okay. Did I get it?
Mm-hmm.
Okay. Now we're going to do patellar. Okay. I'm going to do the other patellar. All right. We're going to do the Achilles. Okay. And do the other Achilles. All right. Then we're going to do Babinski reflex. Oh, that really worked very well because, let's see. Yeah, it didn't work. All right. Okay. A little bit. Try it again. All right. That's all of our reflexes. I'm trying to think what else I needed to do. We need to do gait, so, and we need to do vertebral column. So go ahead and stand up for me. Now we need to do hip extension. So bend backwards this way. Oh wait, no, that's vertebral column extension. Sorry. So bend back from the waist. All right, now bend forward. That's going to be flexion of the vertebral column. Now I need you to turn this way, and then kick out your right leg behind you for hip extension. Okay, and do the other one. All right, now we are going to check your balance. So put your feet together, all the way together, all the way together, and close your eyes. All right, Romberg test for balance. Okay, you can open your eyes. Now we're going to test his gait. So walk towards me. All right, now turn around. You're going to do tandem, so heel to toe. No, wait, heel to toe, heel to toe. Okay, there you go. All right, and stop. Come back this way and walk on your tippy toes. Okay, turn around. Walk back that way on your heels. Okay, I think that's it. Let me look at my notes to make sure I haven't forgot anything. And if I have forgot anything, then we will do that, and then that might be the end. So. A little bit late. Facial movements. We didn't do that. So Smile, frown, puff your cheeks out, raise your eyebrows, close your eyes, and that's it. Let me see what else I forgot. Sorry, I probably wasn't supposed to like do that like right as I was looking at my notes, but okay, hold on, let me look at what else. So that we did that kind of late, did that. This would test. Okay, we missed a bunch. All right. Turn around. So I'm gonna do, you can sit down. You can sit down, sorry. All right, I have to do thoracic expansion on the back. So, okay, take a deep breath. All right, that's thoracic expansion. Now we're gonna do shoulders. So, shoulders up, all the way up, and then cross them in front of you. That's abduction and adduction. Put them behind you. That is internal rotation. Put them behind your head. External rotation, okay? Now put them out like this. Lift up against my arms for strength. Okay. Oh, and I need you to lie down again because I gotta do some other stuff. Okay, so we're gonna palpate the kidneys. So come over here. All right, take a deep breath. Take a deep breath. Okay, that's the right kidney. Okay. Left kidney, take a deep breath. Okay. Then we're going to do liver palpation. So take a deep breath. Okay, that's liver palpation. All right, you can go ahead and sit up. We're going to do stereognosis. And then we have to do touch.
It's right here. No.
Oh, there it is. Okay, thank you. Okay. So we're going to do sensation. So again, we're having the cotton ball. And then just tell me when you feel it. Close your eyes.
Mm-hmm. Yes. Mm-hmm. Yes. 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 Mm-hmm. Mm-hmm. Yes. 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 Yes.
Okay. Now we're going to do I don't remember what it's called. We're going to test your ability to sense pain, sharp and dull. So this is what it feels like. This is the sharp pain. Okay. This is the sharp pain you're going to feel. Okay.
Mm-hmm.
This is the dull. So I just need you to close your eyes and just tell me if you think it's sharp or dull.
Sharp.
Okay.
Dull. 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 Dull.
Sorry, I'm not doing it right.
Sharp.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp.
Okay. Now we're going to do stereognosis with two different items. I'm going to open and put some items in your hand. I need you to tell me what they are. Okay, close your eyes.
It's a coin.
Okay. All right, and now I'm going to put something in your other hand. Tell me what it is.
It's a key.
Okay. Now I'm going to do graphesthesia. I'm going to draw a number in your palms, and you need to tell me what it is. Close your eyes.
4.
Okay.
9.
Okay. Now let me see if I did everything again. So I'm gonna have you put your fingers out. So we're gonna do something called joint position. So this is neutral, up, down. So I'm gonna move a couple of your different joints and you need to tell me if it's up, down, or in neutral position. Close your eyes.
Up. Down.
What's this?
Neutral.
Okay.
Down. Up. Up.
Okay. What's this one?
Neutral. Down. Up.
Okay.
Neutral. Up. Down.
Okay, and now we're gonna do finger to nose. So put your arms out, close your eyes, and you need to touch your hand to your nose, or your finger to your nose, both hands. And now do it a little bit faster. Okay, you can stop. And now we're gonna do, take your finger, touch your nose, and then touch my finger. So touch your nose with your finger, and then touch mine, okay. Okay. Okay, let's do your other hand. Okay. Trying to think if I covered everything.
It's a great deal to remember.
Okay, I think I'm done. Thank you, sir, for being my volunteer.
You were wonderful.
Thank you, professors. Okay, we're done.